I'm originally from Springfield, Louisiana, in eastern Livingston Parish. I've lived there pretty much my whole life. Spent 22 years of my life there. I'm 32 now, and after graduating from Springfield High School, I went to Southeastern, spent 4 years there, taught at nearby French Settlement High School, chemistry and physics for 2 years, then went to medical school at LSU in New Orleans. Spent 4 years of my life down there. Between that time of when I was in college and when I started teaching and went to medical school, I got married, met my wife at Southeastern, and so she was with me down in New Orleans when we moved there. After I graduated from LSU, I went to Mobile, to the University of South Alabama, and spent a great 3 years there. And that actually leads me back to how I got here. One of my friends in residency, he was 2 years older than me, Joe LaRiviere, is a doctor here, and he kind of recruited me to come back to the Baton Rouge clinic. The first 2 years of medical school are spent, learning the sciences, learning about disease. The third and fourth years are spent in the clinics and learning with the patients, and the patients are teaching you. Internal medicine is really a specialty unto itself. You specialize in adults, and it allows us to do a couple things that I liked about internal medicine. It allows us to, one, spend a lot of time with our patients and get to know our patients, and it's somebody you can start taking care of them when they're 16, and you can take care of them until they're in their 90s. And so you know everything about them, you know everything about their family comes to see you, and so it's like a social medicine. So that was one reason that really drew me into internal medicine. The second part is I was always interested in, I watch NCIS, CSI, I was always interested in these science shows and the detective shows, the police shows, and I think the easiest thing I could do without getting shot at would be to be medicine, and I could still be a detective. So internal medicine, you have somebody comes in, you don't know what's wrong with them, you're seeing them for the first time, and you have to really dig down and figure it out. And it's really one of the only specialties in medicine where you sit there and you really have time to think about what's going on, and to really diagnose and work through a few different diagnoses before you reach the final one. And I think that's rewarding for me, and it's rewarding for the patient when you finally have the right diagnosis. And that's really why I chose internal medicine. A good day is feel rewarding when you diagnose somebody and provide them with relief. And that can be I've had that happen in numerous occasions. So one, they may come in with abdominal pain, and you get the CT scan and they have appendicitis. Well, now they have to go to the hospital and have surgery. Well, they weren't happy they have to have surgery, but they're happy you figured out why they were hurting and saved their life. And another situation that we see a lot is, with mental health, depression and anxiety. I actually like dealing with, a lot of doctors don't actually like talking to people about depression and anxiety, and treating them. And when they come back and see you in 4 weeks after you started on medication, you see that, hey doc, that really helped, thanks. That makes me, feel like, man, I've had a great day today.